Next, we're going to be looking at the structure of a nail. This is a modification of the epidermis found on your fingers and your toes. What part should you know? Well, the free edge, which is the part you cut, the body, that's the pink part of your nail, and that pink is due to blood vessels that underlie the body of the nail. There's also the lanula, that's a white semicircle on the nail, and luna means moon, and the lanula looks like the white crescent moon. Well, there's also an eponychium, a proximal nail fold, also known as your cuticle, and the quick, or the part under the free edge. Now, this is where dirt accumulates. So, eponychium and hyponychium you're probably familiar with, but you probably call them cuticle or quick. So, when we're looking at a nail, we're looking at a modification of the epidermis. There is a proximal root of the nail that we can't see, that's under the cuticle. The nail bed is also under the nail, and when you press down on the nail body, this part tends to flush pink or be darker in color. The nail bed is actually directly under the pink part of the nail. The nail matrix is also a growing edge that's under the skin. It wraps around the root of the nail, and this is where cells are actively dividing and performing mitosis. This is where we're creating cells that become parts of the nail itself. This is how we see nail growth. You can also see in the image on this slide a better view of the lanula, that kind of lighter in appearance crescent shape that's close to the cuticle. Well, what's the purpose of your nail? Well, it provides protection. It's also going to help with things like cutaneous sensation and pressure, but there's more to the integumentary system than just protection. We also want to look at things like body temperature regulation and metabolic functions, and the fact that your integumentary system, because it includes connective tissue, is also a blood reservoir and functions in a little bit of excretion. There's many different functions for the integumentary system. Yes, there's protection, which is chemical, physical, and mechanical, because you have a low pH on your skin and that helps inhibit bacterial multiplication. You also have body temperature regulation, which is accomplished by dilation or constriction of those vessels that are in the dermis. And if we dilate those vessels and blood flows into those small capillaries, that brings heat near sweat glands, that causes the sweat glands to produce sweat, which is a cooling system for the body. Of course, there's cutaneous sensation thanks to all the many mechanoreceptors throughout the epidermis and dermis, but there are metabolic functions we haven't talked about. The skin is capable of synthesizing vitamin D. So that begins in the skin in dermal blood vessels, but it finishes up in the body to create active calcitriol. And the reason that the skin is a blood reservoir is because the blood vessels in the dermis can hold up to 5% of the body's total blood volume at any one point in time. But the skin vessels can also be constricted to shunt blood to other organs, such as exercising muscle, specifically skeletal muscle. And even though not a lot of excretion occurs with the skin, there are a limited amount of nitrogenous waste that are eliminated from the body in sweat. So there's many different functions for the integumentary system. So take into account when you're thinking of what all can the integumentary system do, take into account all of the modifications like hair and nails and glands. So that is what is providing a lot of breadth to the functions for the integumentary system. Our next focus is going to be on skin cancer and burns. And the skin can develop over 1,000 different conditions and ailments. There's internal diseases that reveal themselves on the skin, there's infections, there's common disorders that cause changes in color to the skin, but less common but much more damaging are the conditions of skin cancer and burns. We're going to start by looking at skin cancer. Now, cancer is just a name given to a collection of related diseases. We're going to focus on skin cancer. Now, what cancer is, regardless of where it's located, is uncontrolled cell growth. And most skin tumors tend to be benign. They're not cancerous, they don't spread, which is metastasization. But there are risk factors that can increase the formation of skin tumors that are malignant, that do spread, that can metastasize. And those risk factors are overexposure to UV radiation and frequent irritation of the skin. Now, our body does offer some protection. There is, for example, the P53 gene, or the guardian of the genome. As As long as it's activated, there should be many anti-cancer functions that it plays a role in, like apoptosis of those cells that lose control of their cell making machinery. It also provides genomic stability and inhibition of angiogenesis, or the production of blood vessels, to provide nutrition to tumor cells. But this p53 gene can be disabled, especially by mutations due to UV radiation and other just kind of chance mutation occurrences. So, a crucial risk factor for non melanoma skin cancers is the disabling of that p53 gene. There are three types of skin cancer we're going to look at: basal cell carcinoma, squamous cell carcinoma, and melanoma. Let's start with basal cell carcinoma. It's the least malignant, most common type of skin cancer. It is skin cancer of stratum basal cells. They proliferate, they form essentially a tumor, and that invades the dermis and hypodermis. But it's pretty slow growing, it doesn't often metastasize or move to other areas of the body. So most of the time, it can be cured by surgical excision, and that's in 99% of cases. Now, squamous cell carcinoma arises from the keratinocytes of stratum spinosum, not the basal cells like a basal cell carcinoma. Now, often we would see this on the scalp, the ears, the lower lip, and it grows very quick, and it can metastasize if it's not removed or treated quickly. But if you do treat it quickly, the prognosis is good, but you might want to also add radiation therapy after it's been removed surgically. Now, the most dangerous type of skin cancer is melanoma. This is the cancer of melanocytes. And that's because this cancer is highly metastatic and resistant to chemotherapy. That's why it's so dangerous. Now, it can be treated by surgical excision, but usually also wide removal of tissue surrounding the tumor. But you also generally accompany treatment for melanoma with immunotherapy. But still, chances of survival are poor if the lesion is over 4 millimeters thick, which is not large at all. And it's not just wide, that also would include a depth. So sometimes it can get quite large before you notice it. So early detection is key for melanoma. So what are some of the rules or things to look out for when you're trying to detect skin cancer? Well, with especially melanoma, we have the ABCD rule, where we look for changes in symmetry. If suddenly your mole or a spot on your skin becomes asymmetrical, or if the border changes, or if the color changes, or if it starts to grow. These are all things you want to look for when you're trying to look out for melanoma. Here are other views of the asymmetry and border shifts and color shifts and growth with diameter that we can see utilizing the ABCD rule in order to identify possible melanoma. So again, that's just a quick look at some of the things or changes that could occur and is a characteristic of formation of melanoma. So just keep an eye on the moles on your body, go see a dermatologist, get a yearly checkup. All these things are very much recommended. All right, and one of the last topics we're going to look at is burns. Burns can be caused by numerous things: heat, electricity, radiation, certain chemicals, but they all cause tissue damage. They all kind of open up cells and denature proteins and lead to cell death. Now, the immediate threat from a burn is not from the damage to cells, but from dehydration and fluid loss. So you can very quickly experience a protein and electrolyte imbalance from severe burns, and that can lead to your kidneys shutting down and circulatory shock. And that's what most often leads to death from burns. Now, there is a rule of nines that we use to estimate the severity of burns. This is when we consider burns critical if they're on over 25% of the body, especially if it's second-degree burns, or over 10% of the body has third-degree burns, or there are third-degree burns on the face, hands, or feet. Well, if we look closely at the image on the right, we can kind of see where we're getting these percentiles. For example, the anterior and posterior head and neck, they count for 9%. The anterior and posterior upper limbs, 18%. Anterior and posterior trunk, 36%. Your perineum is 1%, and the anterior and posterior lower limbs are 36%. And depending on if it's just front or back, there's lower percentages that we're adding together. And that's how we get the overall percentile in order to estimate the severity of burns. But what about different types of burns? Well, there's 3 types. first degree, second degree, and third degree. With first degree burns, only the epidermis is damaged, and general symptoms are redness, swelling, and pain. You never see blisters with a first degree burn. Second degree burns, it's going to include the epidermis and the upper regions of the dermis that are damaged, and you will see the same symptoms as a first degree burn plus blisters. And with a third degree burn, the entire thickness of the skin, the entire epidermis, the entire dermis is damaged. And the burned areas can appear anywhere from gray white to cherry red or black. And there's not really going to be any initial edema or swelling or pain, because initially with a third degree burn, it's so serious and so complete that nerve endings are destroyed. So again, with a superficial burn, we're talking about a first degree burn because it's only that superficial layer that is damaged. With a partial thickness burn, we're talking about a second degree burn because it doesn't go all the way through the dermis, but it does do so partially. And blistering is common and expected with a second degree burn. Then a full thickness burn or third degree burn is the most severe and extreme. And we can see variations in color from cherry red to kind of gray or a pallor to really dark skin when it comes to a third degree burn. And again, those are not initially painful, unlike a first and second degree burn, which do come with redness and pain. So what's the treatment for a burn? Well, the treatment includes debridement or removal of the burned skin, antibiotics and temporary coverings, possibly a skin graft. Some examples of temporary coverings include bandages, but also in some burn units, they use medically grown tilapia skins or medically grown skins from tilapia as a temporary covering to help promote healing. So there's different treatments for burns depending on the burn unit, and there's new innovations all the time. But let's finish up by talking about some developmental aspects of the integument. Now, these can be a little depressing. For example, the fact that we'll start to see as we get older, our skin become oilier, acne, possibly dermatitis, we'll lose collagen. But let's start at the beginning. Let's look at developmental aspects of the integument during the fetal period. So first, the epidermis develops from the outer layer of cells that create a fetus called the ectoderm. And the dermis and the hypodermis develop from the mesoderm. Also, a fetus is oftentimes coated in a downy coat of delicate hairs called lanugo, and there's a substance on that lanugo called vernix caseosa, which is a substance produced by sebaceous glands, and it protects the skin of the fetus in amnion. But as we grow and we develop from a child into adolescence and then to an adult, you are going to see things like your skin becoming both oilier and may include your hair. The skin also shows the effects of the cumulative environmental assaults on your skin at about age 30, and scaling and dermatitis and just conditions of the skin become much more common as you age. And we also see as we move from adulthood into old age that the rate of cell replacement slows, so your skin is going to become thinner, it can become dry and itchy as a result. That layer of fat in the hypodermis going to basically start to diminish till it almost disappears, leading to an intolerance of cold. We also see collagen and keratin start to break down or stop being produced at such a fast rate, and that will decrease elasticity of your skin and cause even more loss to the strength of that subcutaneous tissue and lead to wrinkles. We also see a decreased number of melanocytes and Langerhans cells, and both of these cells do have an immune function in protecting us against UV radiation, melanocytes, and immune risks or things that cause disease, pathogens, and that protection is provided by dendritic or Langerhans cells. So this decreased number of melanocytes and Langerhans cells can increase the risk for skin cancer or other conditions. But even though that last bit may be a little bit sad, those are the things we have to look forward to. Your integumentary system is still a very vast, widely distributed organ system of the body. It's the body's largest organ system and is made up of many components. It's made up of the skin, the hair, nails, associated glands, nerves, and it acts as a great physical barrier between the body and the outside world, and it protects the body from injury, infection, bacteria, and sunlight. So it has all these numerous functions that provide benefits to us. So it may be a relatively simple system made up of epithelial tissue and connective tissue, and general stuff you're familiar with like glands and nerves and hair. but it's still a wonderful system to start with and a great system to see the variety of tissues and capabilities in just a couple of layers of cells. So that's it for the integumentary system. So make sure to go back and review all the video parts and also read your textbook if you haven't.